Hello everyone. So in this series of lecture of POORI TARAH RATO, today we will discuss the difference between chronic bronchitis and emphysema. So chronic bronchitis and emphysema, as we all know, are both the components of COPD, but majorly COPD के पेशेंट में एक ही component होता है, either chronic bronchitis or emphysema. So जो major component होता है उसी के symptoms आते हैं. So what is chronic bronchitis? It is a clinical diagnosis, and how we can diagnose chronic bronchitis is that there is productive cough for 3 months or more in at least 2 consecutive years, while emphysema is a pathological diagnosis in which on tissue diagnosis we can see there is permanent enlargement and destruction of airways distal to the terminal bronchiole. Okay, now what are the clinical features of chronic bronchitis and what are the clinical features of emphysema? So chronic bronchitis patients are mostly overweight and cyanotic because of the obstruction of the airways and mucus plug stuck in the airways. So they will be having elevated hemoglobin. Why? Because cyanosis is there, so secondary polycythemia hoga inme. Peripheral edema will be there because they have a more chance of or pulmonary as compared to emphysema patients, and that's why they are also overweight. And rhonchi and wheezing because of the obstructed airways due to mucus or due to fibrosis. Okay. While in emphysema, the patients are mostly older and thin. There will be severe dyspnea due to destruction of the airways. The chest will be quiet, okay, because there is no recoil because of the destruction of the airways. And X-ray will show hyperinflation of the lungs field with flattened diaphragm and tubular heart. Okay, so definitely chronic bronchitis and emphysema difference is a very important thing, and many times the question has been asked on this. Okay, so all the best, guys.